Hi, welcome back to Buzz on Business. Our next guest is Dr. Micah Gurick from Brunswick Animal Hospital. Welcome, Dr. G.
Thank you.
Tell us a little bit about yourself and your business.
Well, we have several other locations in different areas, all kind of around the Akron, Solon, North Royalton area. We had an opportunity to come into the Brunswick area, and I know it's a great location, great community, very family oriented. So our goal is to provide high quality medicine at affordable prices for the clients. And then also really we strive a lot in client service so that you feel comfortable bringing your companion to us and have the doctors really explain to you what's going on, because I think sometimes that doesn't happen that much for people.
Right. When people bring in their pet who's sick, they're really emotionally stressed out.
Correct.
And it sounds like you have a good bedside manner with the pets.
Yeah.
Is it dogs, cats, rabbits? What's your clientele?
Yeah, we'll pretty much see any pet that you may have. Majority of it is usually dogs and cats. You will see some exotics once in a while, which would be reptiles or snakes. A lot of times, usually people have smaller pets like hamsters, guinea pigs. Those are a little bit more common out of the smaller pets that we'll see.
Okay, you haven't noticed any pythons
no,
through your
nothing,
door?
Right, exactly.
Okay, that's good. Just want to know. So who's the perfect, I've been dying to ask this question, who's your perfect customer? And I mean the four-legged or the two-legged variety.
I think they're all, kind of mixed with that as far as if you're talking about if they're nice, because usually that's what everybody asks.
Did you get bit?
Actually, I always tell clients I'm usually not intimidated or worried about the large German Shepherds or Rottweilers or anything like that. I'm more worried about the cat that's a little 8 pounds of fury once cats get going. So usually cats are the ones that everybody needs to be a little more cautious with and watch. But usually I think it's just kind of how you handle them, and if they feel safe, then cats usually do very well in the exams.
Okay. Do you have a favorite dog breed or cat breed that you?
That's a great question. No, not really. I think I've always been one that likes bigger dogs, but then just recently we had to adopt a Cavalier King Charles, and so I started falling in love with them, and my kids really got close with them. And then I have 4 cats at home, so
I was going to ask what you have at home.
So I'm very fond of cats too, so I think it's a good mix.
Okay. Did you have that special pet growing up when you were a boy that made you want to be a veterinarian?
Yes, I think I did have a couple experiences with pets, and then also a couple strays that were around our neighborhood that you kind of just started growing close to, and then I always had a love of science, and then it was a good mix with dealing with the animals too.
Okay. Did you have a mentor or someone that you looked up to in the field that guided you onto the path?
I guess, well, when I was younger, I volunteered a lot. Once you're under the age that you're allowed to work and stuff, I did volunteering at some local hospitals, and then as I moved on, there were several vets that I worked under before I went to vet school that helped out a lot and kind of kept the fire going, because sometimes you burn out and you have to do a lot to get into school. So there were several people that helped me along the way through that.
Great. Where do you see your business in a few years? Do you have any goals, or are you going to be expanding again?
I think our goal is basically to keep providing clients with good client service, good quality medicine, and make them feel special when they come in there. Our biggest problem that I guess I don't like seeing in vet medicine is the large amount of corporations that are coming in and taking over the field. And then I think what we're losing a lot is that community feel that veterinarians used to have, where you would come in and know, everybody from the grandparents to the kids.
Their dog's name, you know who their dog's mother was.
Right, and I think that's very important. I think it's important in society now, and I think we're starting to drift away from all of that community involvement, and we're starting to get into this more commercialized, you know, kind of medicine, and I think it takes away a lot, like you hit the nail on the head earlier, of bedside manner. And I think that's very important for people, because they don't talk to you, so you really don't know what's going on. So you need a doctor that can explain everything to a client, so that they are understanding and comfortable with what's going on and what decisions to make afterwards.
Yeah.
So that's really our goal, is to kind of keep that going and don't let some of the smaller animal hospitals die out and kind of just disappear.
The neighborhood, yeah, that knows your animal.
Right.
Has technology helped in your business?
Yes, we have, like at every location, and in Brunswick, we have digital X-ray, and so that provides a lot better quality and detail to see stuff. It also enables us to email them out to boarded veterinary radiologists, where they can read them in about 30 minutes and give us results back.
Great.
We do have ultrasound, which allows you to do a lot of diagnostics without having to do anything invasive surgery-wise. We also have in-house blood work, where we can get results back in 30 minutes, so that really helps to provide treatments. We do have hospitalization, where we can hospitalize your pet if need be. We have laser surgery, so that eliminates a lot of the bleeding. It's less painful, works great for like declaws and stuff of that nature. And then we also have laser therapy, which is real big now, which provides dogs, because now vet medicine is getting so good at extending the lives of all the pets, that they're starting to get more arthritis and different things like that. So laser therapy is a nice way where you don't have to keep them on oral medications, but it allows them to get the comfort and provide them with a little less pain through that. So we do have a lot of high tech, as you will, for doing those things.
That's great. So do you have any advice to pet owners for caring their pet? What's the most important thing they should be doing, other than seeing you?
I think some of the stuff that's the biggest thing is being progressive and being ahead of things, meaning that if you have a pet that's over 7 years old, we really try to have you do what we call senior blood work. And what that does is we do it once a year, just like us, as we get older, your doctor likes to do. And that gives you a baseline and something to check, where we can look back on it if your pet does get sick, but we can actually see if something's developing and then treat it before it becomes a problem. I think that's important. And then also dentistry is a big deal.
Yeah, it's hard to brush their teeth.
Yeah, no, brushing teeth is hard, right. But I think doing some stuff by giving them certain chew toys that helps brush their teeth. Also having dentals done, because with research now, it has shown that it adds several years onto their life to have their teeth cleaned, and then also prevents dental disease, or heart disease, I'm sorry. So I think that's really important. So those are probably the two best advices I could give for like just medicine in general.
Great. Well, maybe that's a good place to end then. Right. So thank you, Dr. G, for being with us today, and good luck with your business.
Thank you.
We'll be right back with our next guest.